Hello, so today I'm going to talk about the impact of Helicobacter pylori eradication on platelet counts of adult patients with idiopathic thrombocytopenic purpura. So what is idiopathic thrombocytopenic purpura? So idiopathic thrombocytopenic purpura, or ITP, is an acquired disorder characterized by autoantibodies against platelet membrane antigens. So patients may be asymptomatic, and if there's a case that the patient has symptoms, so the symptomatic patient, it ranges from easy bruising to severe bleeding. Now, let's talk about Helicobacter pylori, or H. pylori. So H. pylori is a gram-neg microaerophilic bacterium that colonizes its stomach. And in recent study, it has been discovered that H. pylori is implicated in various autoimmune disorders, including pernicious anemia and, of course, the ITP. Approximately, there are 50% of world's population that are infected with H. pylori, making it the most prevalent bacterial infections in the world. And its prevalence is greater in low-income countries than in developed ones. So the exact route of infection is still unknown, but fecal-oral and oral-oral routes seem to be the most likely. So this study was conducted at the University of Damascus between October 2016 and October 2017. So the study included all adult patients of both sexes who were diagnosed with ITP according to the American Society of Hematology as follows. So first is general platelet count is less than 100 times 10 to the power of 9 per liter. And second is the exclusion of the secondary causes of thrombocytopenia like drugs, hepatitis C virus, HIV, and etc. So there were some cases wherein patients with ITP are not included in this study. So there are the criteria for exclusion. First are the patients younger than 14 years old. Second, patients with life-threatening bleeding or inactive hemorrhage requiring immunosuppression or other therapeutic options to increase platelet count. Third, patients with secondary causes of thrombocytopenia, including any drugs that are suspected of developing thrombocytopenia. Fourth, taking antibiotics to increase platelet count. Third, patients with secondary causes of thrombocytopenia, including any drugs that are suspected of developing thrombocytopenia. Fourth, taking antibiotics, proton pump inhibitors or H2 blockers a month before screening for H. pylori because they lead to false negative. And lastly, any previous H. pylori eradication program. So patients who were not infected with H. pylori did not receive any treatment that aimed to increase platelet count during the follow-up period. So this method helps to ensure that differences in outcomes are more likely to result from H. pylori eradication rather than other confounding treatments. After obtaining the final results of patients at the end of the 6 months, they were divided into 3 groups according to their response. So the first group are the complete response group, including 10 patients. And the second group are the partial response group, including 18 patients. And the last group are the no response group, including 22 patients. Patients who achieved complete or partial response were all H. pylori positive, while H. pylori negative patients did not achieve neither complete nor partial response. The previous findings indicate that the improvement noticed in H. pylori positive group is often due to H. pylori eradication, not a spontaneous improvement. So according to the result of this study, age and sex are not related to achieving response while baseline platelet count and H. pylori infection status do. The scientific explanation of this improvement is that the pathogenic role of H. pylori infection in the development of ITP is still unclear, but several mechanisms are suggested. Bacterial antigens and glycoprotein platelet surface antigens express some similarity. So next, when antibodies are produced against these bacterial antigens, they interact with the glycoprotein platelet surface antigens, thus lead to decreased platelet count. And lastly, some strains of H. pylori induce platelet activation mediated by H. pylori-bound von Willebrand factor interacting with GP1B and supported by IgG. In conclusion, H. pylori eradication in ITP patients lead to significant improvement of peripheral blood platelet count in most patients.